name is Hillit Meidar-Alfi. I'm co-founder and CEO of Spatially Health. We are an advanced SDOH and health equity platform where we're working directly with providers to better understand the health barriers at the individual patient level and then help determine and match the best intervention type for that patient. What we find is providers today really want to make sure that they are addressing the social risks and the needs of the patients, but they're hard-pressed to find the right tools, not only the data, but also the information, and be able to know what is the best course of action or services outside of medical services that would best improve the health outcomes of their individual patients. We focus primarily on REACH ACOs, which we love to work with, MSSP ACOs, Medicare Advantage, and some managed plans as well. They really come to us to understand what does their patient population deal with from a social risk perspective, right? What are essentially those health barriers that are impacting the health outcomes? But from the provider side, they want to be able to engage with their patients as well. If they're missing out on some of this engagement, it's really difficult to provide medical services, let alone improve the overall health of the patient. So first and foremost, they want to come and understand, well, what does my patient population look like from a social determinants perspective, right? What are some of the health barriers? For example, we know that about 76% of the entire US population has at least one social determinant, factor working that they're living with. About 64% have two or more, and about a third of the population has multiple SDOH health barriers that are impacting them. Do the providers really know who these patients are and what specifically those health barriers are? We know that healthcare is really local, and even for them in any one of their geographies or in their markets, they see tremendous variation from one patient to another. So for them to have the ability to understand at that individual patient level specifically what are those health barriers that they're dealing with is really important for them to best address that in terms of interventions that they either have already implementing as part of their operations, or even more so, what are the interventions that they're perhaps missing that they want to be able to reach out and be able to bring into their services so that they can better care for their patients.